Hello, my name is Dr. Sophie Hose. I am a chiropractic neurologist at Georgia Chiropractic Neurology Center here in Atlanta, Georgia. And today we're going to be discussing how chiropractic neurology can be beneficial for athletes of any form. So both professional as well as more of a weekend warrior or just everyday recreational athlete. I am a doctor of chiropractic with further training in what we call chiropractic neurology or functional neurology. I have a diplomate with the American Chiropractic Neurology Board, but I'm also specializing in sports chiropractic. So I hold a master's degree in sport health science, and I'm a certified chiropractic sports practitioner. I went to Life University here in Atlanta and received my degrees from there, as well as Carrick Institute in Florida for my postdoctoral neurology studies. This right here is our team at Georgia Chiropractic Neurology Center. In the middle, you can see Dr. Mark Ellis. He is the clinic director of our office, and then that's the whole staff of our 7 doctors in total. We all specialize in slightly different aspects within the field of chiropractic neurology. But we all hold postdoctoral studies in chiropractic neurology or functional neurology. We're all chiropractors to begin with, and we'd be happy to have you here at our office. When we're talking about athletes, or honestly any form of movement on a daily basis, there is this concept to understand of how do we even actually move. And from a neurological standpoint, we look at it as a threefold process. So there's what we call feed-forward activation, efferent copy, and then feedback information. So the way that this works is during the feed-forward activation process, it's your brain's way to activate itself as well as the appropriate postural and involved muscles. It's kind of the planning of the whole movement. So let's say I want to reach out and grab something. I need to prepare my body to do that, and I need to have the actual what we call motor plan to do it. So I need to know which muscles do I want to move, in which way, in which angle, how fast, how far do I have to reach, what other muscles maybe need to be activated to stabilize the rest of my body, and where is the object in space that I want to grab. All those things come into play when we look at the feed-forward activation. So this is your brain making a plan of how to move. The efferent copy is then, think of it as your brain kind of CCing itself on an email. So we've sent the information of what we want to do to the part of the body and the brain that's responsible for the movement. But we're also sending this information to parts of our brain that are involved, but maybe less. So, for example, in this case, we would want to send information to our cerebellum, which is at the part of the base of your brain, because it monitors all kinds of movement and it helps to make appropriate changes should anything not go according to plan, as well as to your parietal lobes, which are kind of here in the back on the side of your brain. Because the parietal lobe is responsible for monitoring all kind of sensory input about your body, such as, for example, touch, and like you touching the object, as well as spatial orientation. So where is your arm in space? Where is the object in space? And how can we bring those two together? And then feedback information is all the information that you get while the movement is occurring and after the movement has occurred. So the feedback information tells us, okay, we had a certain plan, we executed the plan, did it work out, yes or no? If no, we know that because we compare the feedback information with our efferent copy information, we compare the two, and then if there's any form of discrepancy, how do we have to adapt and create more feed-forward activation in that sense to improve our movement that's currently happening or that just happened to repeat it. So if I want to reach for an object over here and I don't make it there for some reason, how do I need to modify my movement to actually make it there? So that's that 3 parts process. We make a plan, we have a control that we can always compare our current movement with. That's your efferent copy. And then we get feedback about the plan. And depending on how well it worked out, we either modify a movement or we move on to the next movement. And so part of those this 3-step process is going to be anticipatory and compensatory posture adaptations. So the anticipatory ones happen before the actual movement occurs. So let's say I want to reach for something and it's maybe something heavy, or I need to reach very far. I need to stabilize the rest of my body so that I don't just fall over following my arm, or once I pick it up, that the weight of the object that I'm grabbing does not pull me down. So I need to activate certain muscles to keep me stable. So those would be the anticipatory posture adaptations, because in my feet forward activation, I know that the movement is going to destabilize me in some way, shape, or form. And so I'm going to try and prevent that from happening using anticipatory posture adaptations. The compensatory posture adaptations then happen once the movement has started or while it's over already. So this is where your feedback information and efferent copy come into play, because once I reach for something, I want to lift it up. Maybe it's heavier than I thought it would be, or maybe it's actually lighter than I thought it would be. And so in that case, I need to change the activation of the postural muscles that I'm using to stabilize myself. Because either if it's heavier, I need to use even more muscles, or I need to activate them more. Or if it's lighter, I might have to use less muscles or activate them in a different way. And maybe I have to shift my whole body position because something, my balance has changed. And so I need to make sure I don't just fall over in the first place. So those will be your compensatory posture adaptations. Now, keeping all that in mind, that was just a quick insight into movement in general. But how do we make any of these changes, and how do we make any of these plans? There's 4 main systems that really come into play. There's more, but these will be the main ones, which will be your visual system, your vestibular system, your proprioceptive system, as well as your autonomic system. So autonomic nervous system, really. I'm going to go a little bit out of order here. We're going to actually start with the autonomic one because it's the baseline for everything. So your autonomic nervous system is what controls all vital functions in your body. That might include heart rate, blood pressure, breathing, but also digestion, sexual function, and to some extent your emotional system. And so if your autonomic nervous system is not stable, movement is going to be very, very challenging. And honestly, just general life will be challenging. There's a variety of different conditions that involve the autonomic nervous system, and we group them under the umbrella term of dysautonomia, which has been more and more common recently, and we work with it a lot in our office. There's different sub categories within it, like POTS and orthostatic hypotension, for example, but there's a variety of other ones. So the autonomic nervous system is really what keeps you alive and stable throughout your just daily life. So if that baseline function is not there, it's going to be very difficult to have any other form of proper output of your brain. So if your heart rate is not working appropriately, going to work is going to be challenging. Doing a tennis serve is going to be challenging. No matter what will be challenging, most likely. So a big focus in our rehab would be to make sure that that system is working very, very well. If you're an everyday athlete or if you're a professional athlete, it goes for both groups of people. The next 3 go together when we look at balance a lot of the time. So your visual, vestibular, and proprioceptive systems are the ones that orientate you in the world. And there's other ones in there too, like hearing, for example, which I haven't put in here because these 3 are the ones that we're just focusing on today. But again, there is others. So your visual system is the one that integrates all information that you receive from your eyes, right? So of course, you're able to orientate yourself without vision, but using your eyes is going to be a lot more easy. Whether it's being able to, see a ball that's coming at you while playing tennis or any other ball sport, or just having to decide where your golf swing is supposed to go based on where the tee is at, you're relying on your visual information throughout any sporting activities a lot. And so making sure that you're integrating that information appropriately is going to be very important when we look at athletic performance. Your vestibular system is the system that's living in your inner ears as well as your brainstem. So your vestibular apparatus is the actual organ that lives in the inner ear, and it perceives gravity, both in linear motions, as we call it, so up, down, left, right, forward, and backward, as well as an angular motion, something like this, for example, or this. Okay, backward, same thing. So not linear motion, but more of an arced motion. And that information from the vestibular system is then sent to your brainstem, which is located, again, at the base of your skull, just in front of your cerebellum, where the central portion of your vestibular system lives. And that's where it gets integrated with other information, and it therefore takes into consideration the information from other systems as well. So if your eyes are telling you, maybe you see the horizon going up, and your vestibular system tells you, yep, we are currently moving down, then those two information or pieces of information are going to be matching. If at some point they're not matching, like you see the horizon going up, but you don't feel any movement, then people oftentimes don't feel great. And that's the origin of vertigo for a lot of people, that mismatch of sensory information. So your vestibular system is really important to detect your head position in space. And it's one of the three main systems that gives people a sense of balance. And that's where, it becomes really important for athletes, whether they're in a sport where balance is super important, like gymnastics or ballet, or in a sport where balance might be not the first line of thought, like tennis or golf, but nonetheless still is incredibly important. And if there's even the tiniest mismatch or little perturbation in their balance, for somebody that plays at a high level, that is trying to achieve certain very specific things within their sport, this might actually matter a lot. And then lastly, we have our proprioceptive system. So proprioception is your ability to perceive your own body within itself and in space. So if I raise my arm, I want to know that the arm is up, and I want to know where it is, because it's a difference if it's right here or right here. Especially if I play a sport where I need to know where my arm is, because I'm going to use my arm, like tennis, for example, like any other sport really that uses your arms, which is almost everything probably. And so proprioception is something that can be slightly off, especially after injuries, but also for other reasons. And it's something that can be trained. And so it's a system that we use a lot for our rehab in here. And it's something that should be checked probably for every single athlete. Then, of course, if we're looking at athletes, there's a lot of other things that matter, right? So those four systems that we just talked about are the baseline for everything, but there's other functions that are going to become really important. That might be reaction time in a sport where speed matters a lot, like, for example, tennis. And I'm talking about tennis a lot because we work with tennis athletes in here a lot, and I'll show you some of that in a little bit. But reaction time realistically matters for almost any sport. Sometimes in the sense of because your victory might be dependent on it, and sometimes for safety reasons. Like, for example, a downhill skier that might have to shift based on an obstacle on the slope and within a matter of a few seconds or even less, or somebody like a ballerina or a professional dancer that if they don't shift their center of pressure in the milliseconds where their turn might be off, they might slip and fall. So reaction time really comes into play in many different aspects, and it's something that can be assessed and trained quite easily. Next up, we get rhythmicity and timing, and here we see a interactive metronome in use in our office, where the athlete here is clapping his hands rhythmically, and he has a little sensor attached to his hand, or strapped around his hand. And the goal is to hit the sensor on beat with something that he hears that he beat over headphones, and then gets feedback on the screen. So where a regular metronome doesn't really give you instant visual feedback. The interactive one is nice because you rely on your visual feedback and sometimes auditory feedback as well to adapt the speed of your movement. And so you don't just guess, but you're getting constant feedback of how well you're actually doing, and your brain can adapt to improve rhythmic movement and timing of your motor plans in general. So this is a really awesome tool to improve those feed forward activation motor plans, because your brain will adapt and get better at rhythmic movements, which matter for a lot of sports. And timing the activation of different muscle groups together to accomplish something that seems as simple as moving your arm from one place to the next in space can actually become quite challenging if the activation of muscles is not appropriate. So that's a lot of the time where injuries come from, and where performance might not be optimal because different muscle groups are not working in synergy as well as they should be. And that's something that can be trained quite easily. Next up, of course, we already talked about balance to some extent with the vestibular system, but something that a lot of people don't necessarily think about is not just balance in the sense of does the person fall over or not if they're under certain conditions, like, for example, uneven ground or standing on one leg or running, jumping, whatever, but also if their foot is firmly planted on the ground, or their hand in a sport like gymnastics or cheering. Where is the pressure on whatever part of the body is on the ground? So if it's a foot, for example, is the pressure more on the heel or is it more in the toes? Is it equally distributed between the inside and the outside? If it's on the hand, same thing. For a handstand, for example, in gymnastics, you want to make sure that we're gripping the ground properly. Is that happening? Yes or no? And so we use different technologies in here, from force plates and virtual reality, as well as this little tool right here that you see me standing on and snowboarding down a hill, which is called Bobo Balance. And all those tools give us visual feedback of how the person is doing, both balance-wise and center of pressure-wise. And these things can be shifted and trained under different conditions, which can then be replicated in the sport. Lastly, and again, this is not, a comprehensive list. This is just 4 examples right here. We have eye-hand coordination. And eye-hand coordination, I think, is something that is talked about quite extensively in the athletic world at this point. Mostly, again, for sports that involve your arms, of course, like tennis, again, or something like baseball, for example. But eye-hand coordination involves a lot of reaction time, visual processing, and then spatial orientation as well. Because in this case right here, this athlete is tapping targets on a touch screen as they appear. So he needs to see where they are. He needs to react quickly and move his hand towards where the dot is. And he needs to be accurate in his touch, because if he's just a millimeter off, he will get an error, and the machine will recognize that he wasn't as accurate as he could have been. And for especially professional athletes, that millimeter of accuracy actually matters a lot and can be the difference between winning a point and, losing a match. So this touchscreen, for example, it's called NSI, Neurosensory Integrator, is something that can be used quite easily for eye-hand coordination training, and it can always be layered with different types of therapies. So as people get better at this, we want to make sure that we stress them accordingly, especially for athletes in stressful situations. The conditions on the court, on the field, on the pitch, wherever they're playing, might not always be optimal. So in this case, I would, for example, be able to do a dual tasking activity with this person, for example, where I'm talking to him at the same time and asking him questions, or I'm having him solve certain cognitive puzzles. Or I might be pushing him so that he has to constantly shift his balance and center of pressure. I might be putting him on a wobble board or a foam pad to change the proprioceptive input that he gets from his feet, and so that he has to work on his balance while he does this. The possibilities really are endless. We happen to have a lot of different tools in our office that can all be stacked together so that we can meet every athlete at the level where they're at and always make therapies more challenging as well as easier for the athletes, so that we can really build every single system under any possible condition, and therefore help with different sorts of both problems as well as, opportunities for improvement. So we briefly touched on this during the last couple of slides, but really when we work with athletes, there's three main things that we want to help them with. So any kind of athlete, again, recreational or professional, of course, there's always a chance for injury. And a lot of the time people come to us when they're injured, and that's great. And we can help with that, and we love to do it. But what gets maybe even more exciting and potentially more helpful for the person is once the injury is recovered from, or before the injury even occurs, we can help to prevent injuries, and to improve their ability to perform. So whether it's because we improve their balance under maybe specific conditions, and so they don't twist their ankle or they don't fall doing a difficult tumble move, or whether it's that we shift their spatial awareness so that they're actually looking at the center of a ball that comes at them versus just next to it, and therefore they hit it more appropriately and then win, the tennis match. There's a variety of different things that we can do for anybody in any of these three groups. And then on top of that, of course, if there's any form of other neurological dysfunction, like dysautonomia, for example, or vertigo or headaches or anything else that the athlete might be experiencing, we would, of course, be able to help them with that as well, with the goal to always, at the same time, improve their game, if that's something that they would be interested in. Lastly, what we got to consider with athletes, environmental, recreational, as well as professional, is their environment. And so we have had the pleasure to work with a variety of different professional athletes. Right here, we're looking at a Swedish tennis player. And so a lot of the time when we work with these people is we don't just do the treatment in our office. And these people come to our office, we do what we can, we do our tests, we do our treatments in here, and all of that matters a lot, and we can do a lot of work. But for some people, it really matters to see them in their specific environment. And so for Andre right here, for example, we were working on his serve, because for a very long time, throughout his entire career, for the past 10, 15 years, he has had this breakdown in his serve where he wasn't able to shift his weight appropriately and rotate appropriately, so that the serve wasn't as optimal as he wanted it to be. This man happened to have played, in the Australian Open, the US Open, any kind of Grand Slam that you can think of, and he's a very successful tennis player. He's number one in his country currently. But still, there was something in his game that he wanted better. And clearly he was athletic, super athletic, to the point that he made it to all these different tournaments while still having that less than optimal serve for him. And so he came to us, and that was one of the requests that he had for us, amongst other things. And we worked on it. And here, what we're doing there is some slight fascial pulls that shift his proprioceptive input to his brain, and therefore let him change his center of pressure and rotate and shift his weight differently throughout the serve. And so within just a few minutes, we improved a serve that nobody has been able to improve for the past 15 years, which is super powerful and was quite surprising for him, because that was in the beginning of when he hadn't worked much with us yet. But within just a few minutes, we made a change that was lasting, and to this day is still holding up with him. And so being on the court and seeing the actual movement pattern, and understanding how different environmental conditions might be playing a role into whatever you're seeing in the athlete, is a super powerful tool and can be very, very helpful to improve somebody's performance over time. And then we've talked a lot about our tennis team, but this is an old picture from 2 years ago. We have Dr. Ellis right here on the left next to Jacob Meyer. He is the coach for different players that we've had the pleasure to work with over the past couple of years. And Jacob has been learning from Dr. Ellis along the way over all this time. But in the middle, there is Sam Verbeek and then Andre Goranson, who are currently not playing together anymore. But Sam actually is the current reigning Wimbledon doubles champion. And so he's been with us for many, many years. And we've had the honor to actually be represented on his jersey. So if you look closely, it says Georgia Chiropractic Neurology Center on his sleeve there. And it's been a pleasure working with him over so long. And we've had quite a few other athletes, recreational and professional, along the way in our office. We love working with them. If there's anything at all, that we can do for you, if you have any questions for us, or you would just like to figure out if there's something that we might be able to do to help you either recover from an injury, improve your game in any way, shape or form, or help you prevent injuries, please give us a call, send us an email, stop by the office. We'd be happy to talk to you. And I hope today was helpful for you. Thank you so much for listening.